Welcome to this educational video about low mood and anxiety following an injury. This educational video is brought to you by Cheshire and Merseyside Rehabilitation Network. If you have any further questions about the content of this educational video, please contact your treating team who'll be more than happy to help you. Other helpful resources include the Headway website and the Brain Charity website. If you put these into Google, they should come up. It's really important to say before we start that if you are worried about your mood or the mood of a loved one, please seek help. There are many people that can help you and give you support if you are experiencing low mood after an injury. Speak to somebody that you trust. If you don't feel that you can or you want professional help, you can contact your GP to speak to them about your support options. You can also speak with your care provider if you are open to a care team. If you are worried that you are a risk or that someone you know is at risk, then please call 111 if this is outside of GP hours. You can also speak to the Samaritans who are available 24/7. Please don't suffer in silence. You are not alone and there are many people that can provide you with support and guidance. Low mood after an injury. Low mood can be common after an injury as many changes may have happened in your life, and in many cases an injury can be a very stressful and traumatic event. Low mood can present in many different ways for different people. Only you will know how you are feeling. Many common complaints of low mood are negative thoughts about yourself, others, the world, or the future. Other symptoms can be disturbed sleep, changes in appetite, decreased libido, a reduction in energy, and a general feeling of sadness or low mood. It's important also to remember that after an injury, you may be having trouble with your sleep, appetite, fatigue, or decreased libido. These are not always related to low mood, so make sure you speak with your healthcare provider about how you're feeling and try to check what is happening as a result of your injury and what might possibly be because of a low mood. Our moods fluctuate as part of normal life. Some days will be better than others. Some days you'll feel happy, and some days you'll feel down and sad. This is normal. However, if you are feeling that you are having more bad days than good days, it may be a sign that you need some support with your mood. It can also be very normal to experience reactive depression after a major life trauma. This does not mean that you should struggle alone and you should seek help. However, know that feeling down after a major life event, which can result in major life changes, is normal, and there are people who can help you with this. Ways to help improve your mood. If you are feeling low in mood, then make sure that you are eating a healthy diet, getting enough sleep, and regularly exercising. These are all really important elements of your life that can make you feel low in mood if you're not doing them. They can also be the first ones to go when you're not feeling yourself. It's also important to ensure that you're doing activities that you enjoy. For some people, this can be walking, socializing, doing something creative, getting out into nature, or reading a book. You may find that some of these activities are harder now after your injury, and this may make you feel low in mood. However, you can always make alterations. A few quick examples could be shorter walks, more regular phone calls with loved ones and friends, audiobooks. There are always ways in which to still enjoy the things you did prior to your injury. It just may mean making a few changes to how you enjoy them. It is really important that you try and look at the things that you can still do rather than the things that you cannot do right now. Anger after an injury. You may find that since your injury, you are experiencing more feelings of frustration, anger, or rage. These feelings may be a result of trying to deal with what has happened to you, or perhaps it is as a result of not being able to do the things that you used to do. Or some people find that it doesn't take much, but they are much quicker to anger than they were before their injury. The reason it's important to try and manage this is because it can lead to aggressive or impulsive behaviour that may put you, others, or your relationships in harm's way. It can also decrease your thinking abilities as our cognitive skills work best when we are calm. For example, if you feel yourself starting to get angry, you may find that it's harder to get your thoughts in order. It might be harder for you to remember what you wanted in the first place and then to communicate to people what it is that you want, which only makes your feelings of anger and frustration worse. This vicious cycle will then go around and around until you blow. This can be crying in frustration, screaming and shouting, throwing and breaking things, or storming off, none of which are helpful. This also may lead to hurt feelings if this is directed at somebody else. This may then lead you to feel guilty afterwards. And in the end, your needs are still not met, and you've not communicated what you wanted to the other person. Tips for managing anger. Always remember that different things work for different people. It's about finding out what works best for you and using that. Perhaps you can ask family and friends to help too if you're struggling to think of what triggers your anger and what helps you to calm down. Some helpful suggestions are to remove yourself from the situation. This is not always easy, and many people feel that walking away is a sign of weakness. But it is really helpful, because when you're angry, you're not thinking straight. If you take yourself out of the situation, you can calm down mentally and physically and start to think about things before you do anything. Take 10 deep breaths. It's also really useful to practice this when you're not angry or frustrated. Then, when you do feel yourself becoming angry, you're more likely to remember to engage in the deep breathing, and it will also come more naturally to you. You can also think of somebody or a place that calms you down and makes you feel safe. When you feel your anger start to rise, picture that person and what they might say to you, or picture yourself in your safe place. Again, if you practice this when you're not angry, it will be easier to do when you feel your anger start to rise. Remember that you function best when you are calm. Try to stop and think about the thing that is making you angry. Is it really worth it? If not, try to let it go. Problems and struggles with anger after an injury are really common, and becoming aware of your feelings is the first step. It's also always helpful to talk to somebody about your feelings of anger. Sometimes just speaking about what frustrates you, when it happens, and what you could be doing differently is really helpful. There are people who are trained to help you with this, so do seek them out if you feel you need it. You can always ask your GP or your care team. Anxiety after an injury. We have made a video that looks at anxiety in general, which you may also find helpful. This can be found on the Rehabilitation Network website. However, here we will look at anxiety specific to after an injury. Firstly, anxiety is really common after injuries. Research shows how 30% of people will experience high levels of anxiety after an injury. This is because you are processing and trying to deal with a lot of changes, and this can make you feel anxious, worried, and upset. Know that this is normal. However, just because it is normal does not mean that you may not need some support to help you to reduce and to manage your anxiety. There are people who can support you and help you with feelings of anxiety and worry. People can experience anxiety after an injury because they're worried for the future and this major life change. Therefore, it may be helpful to talk to somebody about this. Common worries. Some people report feeling anxious about the future, about their recovery, about making mistakes, about people looking at them in public, about what their friends and family think of them, about their cognitive difficulties after an injury. There is an endless list of what you can be worrying about, and they're also individual to each and every person. On top of this, some situations can be more difficult after an injury than they were before, like trying to do multiple things at the one time, going into a busy environment, the feeling of being rushed by other people, or sudden changes to plans. Some people experience anxiety as a reaction to something stressful. Someone asks you to do too many things at once, and suddenly you start to feel really anxious. Other people say that they feel anxious about how their injury occurred, and they find that they can't stop thinking about it and replaying it over in their head. It's really important to find out what your triggers are if you are feeling anxious. We need to find out what makes you feel anxious and worried. Tips for managing anxiety. What can you do? You can try to reduce the demands in your environment and reduce any unnecessary stressors. You need to focus on your recovery and take things slowly. Be kind to yourself. Again, taking 10 deep breaths if you're feeling overwhelmed and anxious. This will give you some space to try and reduce the feelings of anxiety and help you to think more clearly. You can also keep a diary and write in the times of the day when you feel most anxious. Write down what you were doing, what you were thinking, where you were. You can then maybe start to see some patterns and see what is possibly triggering your anxiety. Write down the thoughts that are worrying you. Is there anything that can be done to solve the things that are bothering you? We are experts at avoiding things that make us feel anxious, but this can make things worse as we never solve the issues that are bothering us and they keep coming back to worry us. Also, again, please seek help if you feel that you are struggling with worrying thoughts or feelings of anxiety, as there are people that can help you with this. Adjusting after an injury. You may find that you're struggling to adjust after an injury. There are many areas that you may find difficult to adjust to. These can include losses, the loss of a role, a job, a part of your identity. You may be struggling to adjust to a physical difficulty as a result of your injury or a cognitive difficulty. Many people struggle with their new sense of self after an injury, as they may not be able to do the things that they could do before their injury. And a lot of people can start to compare themselves to how they were before the injury. These are really normal thoughts, but they can also be a very difficult time emotionally for people, and there are people that can support you with this. There are also very helpful resources on our website that look at adjustment after an injury. If you go onto our website, you'll be met with this main page. If you then go into the tab that reads Patients, where you will have found these videos, you'll be able to find the resources to give you more information on adjustment after an injury. When you click on the Patients tab, you'll see here Patient Information Leaflets. Here you'll find more information about adjustment. You can also find our other videos under the Psychoeducation tab in the drop-down menu. Thank you for listening. If you do have any questions about your own difficulties with your mood, anxiety, or adjustment after an illness, please contact your care team or your GP for more information. They will be more than happy to help and support you.